Thank you. So nurses and support workers of the RCN are now joining our colleagues in the CWU, RMT, UCU, PCS and FBU and more in strike action. And close to 1 million NHS workers have been balloted across the health unions representing NHS staff across the board, including porters, admin, cleaners, support workers, nurses and more, with results to follow at the end of the month. These strikes are of historic scale and of massive significance in the NHS. The RCN are taking its first UK-wide strike in its 104-year history. Many staff have taken confidence that they are not on their own, seeing strikes in the rail, in the mail and so on. And we send solidarity to all workers taking action and to all in struggle. The value of NHS workers and all workers was clear during the pandemic. However, the claps from the government were meaningless when the working class have faced attack after attack on our jobs, our conditions, our homes, our services and more, which is why we are organising in the NHS like never before. I've been a nurse for 18 years and there's never been a more crucial time for the NHS, its staff and its users. Striking for us is absolutely about pay. After years of deliberate pay erosion, 27% of trusts have food banks for staff, but it's also about the safety of our patients and about privatisation. It's about stopping the excuses that are being made to bring in private companies and outsource staff. It's about putting funding directly into recruiting and retaining staff and ensuring we have a fully staffed workforce to get through the 7.1 million on waiting lists, and it's about giving our patients the best care we can. Now, the NHS was founded on a socialist basis, and we need to be present with our programme fighting for a socialist NHS as we see the health of our nation suffering, inequalities increasing and the gap between the rich and the poor widening, because there really is no other representation relevant to the working class and one that would safeguard the future of our NHS. Steve Barkley, the Health Secretary, again, said he was saddened by the proposed industrial action by the RCN, which he said was in nobody's best interests. What isn't in everybody's interests is the end of free universal health care and not looking after the staff that look after us. Wes Streeting, as Shadow Health Secretary, is not going to defend the NHS. He's openly said we need the private sector to help reform the NHS, and he refuses to back our calls for above-inflation pay rises. So we know health workers and the rest of society cannot rely on putting the NHS in the hands of the Labour Party. We need to kick out the profiteers, the privateers, and renationalise the NHS for the benefit of all of society. Which takes our fight into fighting for a new mass workers' party and the need for a democratic workers' control and to get rid of capitalism altogether. The government and the media have been attacking us for strike action, but the reality is we have public support. NHS workers do not make the decision lightly, but we know things will just get worse and more staff are seeing it as their responsibility. We have seen what's been growing over the last year, and it's showing us that the working class are fighting together, and we need to keep going by pushing for coordinating our strikes in the health unions and across all sectors, and organise for a general strike to force the Tories out altogether. Thank you and solidarity.